The reluctance or refusal to vaccinate against the influenza virus is one of the major contributors to flu-related deaths so far. It's known as vaccine hesistancy. At a media conference today, Minister of Health Terrence Deyalsingh urged the population to ignore the anti-vaxxers and get the flu vaccine. He again reiterated that it would lessen the chances of dying from the virus. Mahalia Joseph Wharton has more.
As of Friday, 27th December 2019, the cumulative number of vaccines administered to the public for this flu season is 48,411. The number of suspected influenza cases for the year is 3,434, and the number of confirmed influenza deaths for this flu season is 37. PAHO WHO country representative Dr. Erica Wheeler said there's no need for panic as it pertains to the number of flu deaths in Trinidad and Tobago.
Everything that we have seen says, although there was an elevated number of deaths, it is still within the normal range and there was no need to panic.
Minister of Health Terrence Deyalsingh is encouraging those in the vulnerable groups and the rest of the population to get vaccinated. He reminded that the vaccine must be taken at the start of each new flu season, as the virus has a defensive mechanism which causes it to mutate each year. He said the current flu vaccine began formulating in January 2019.
The efficacy of influenza virus vaccines varies from a low of 10% to a high of 90%. If the scientists guess correctly in January to deliver a vaccine in October for a flu season starting in November, then all is well and good.
Minister Deyalsingh described influenza as a complex, ever-changing virus that adapts to protect itself from elimination by human beings. He said influenza A, which is H1N1, and H3N2 begins circulating at the start of the flu season, which runs from October to May.
It's not influenza A that is making its normal early appearance, but now influenza B. This is what we are fighting with. There are so many variables that we have to consider because the influenza virus is protecting itself.
He made it clear that the vaccine protects against influenza A and B and not the common cold. The flu vaccine is available at no cost at all health centers. Persons in vulnerable groups are urged to get the flu vaccine. These include children aged 6 months to 5 years, pregnant women, adults over 65, people with chronic medical and respiratory conditions, persons in the healthcare workforce, and essential services are also encouraged to get the flu vaccine. Mahalia Joseph Wharton, TTT News.